Next, because our districts have been paying for mental health services out of their special education funding, their general special education funding, our next great concept is to take the fee for service that they've been paying for their West End clinical counseling services and now move that fee into this restricted mental health funding. So what that does is it aligns the service with what the dollars are for, and it also then provides the district with money that can be used in general special education that they've been using for mental health. So it's a benefit to the districts there. We also have some cost associated with residential care, and those parents, we hope to eventually reunite the family, and it's important for the parents to participate in the therapy when the children are in residential care. So we fund the parents to, we fund the cost of their transportation and hotel and food to visit their children when they're in residential treatment. And we also have to fund the transportation, and we've always had to fund that even before with AB. And sometimes when these children are transported, some of these students are not in the state that you can just put them on the plane and hope that they're going to get there successfully. So we have what's called here escort services, and it's usually 2 individuals that, so the student is always under the direct supervision of somebody when they're transported.
So they're not local residents? Are there no residents?
So they are in, some are in California, others are in Utah, Texas, Colorado. They can be further than that, but that's...
How do you realize the ones that are here? I mean, is there a reason for that?
Some types of students will not be accepted at facilities here in California.
And why would we be accepted?
Because they require a higher level of supervision than the facility here in California would provide. Also, some of these facilities are very specialized. So, I mean, you have children that you're having that are in high risk for suicide. So, I mean, we're talking very serious mental health problems. Children may be drug addicted, students who may have sexual deviancy, and so they very carefully choose the facility to match the nature of the student's problem. So also one of the mental health services we've been provided for a long period of time is our clinical parent training program. We offer that twice a year here in English, twice a year in Ontario, Montclair in Spanish. And also we do have our parent project, which is for our older students. And so we're proposing to move that cost, again, out of, that's been paid out of regional services money, the money that supports our program specialists and such, and move that into this mental health allocation. So we're basically trying to move all of the services related to mental health and take them out of the restricted mental health money.
John, can you repeat the name of the districts where they have the parent project?
The parent project only operates here at the West End SELPA.
Yeah, you said Ontario Montclair has also.
Ontario Montclair has the clinical parent training program.
Yeah, is it only the only district?
That's the location. It's for all of our
Right, but
parents.
that's the location.
But we located, we locate the presenters in Ontario Montclair. The SELPA still pays for them and everything is, but it's located in Ontario Montclair because that's where the greatest need is.
Yeah, I just wanted to know if it was the only location.
Yeah, we don't have any trainers who are trained in parent project who speak Spanish. So then also, there is some SELPA support staff, people who do all the billing, people who also chair the IEPs. We have one staff member who's been hired primarily to supervise our residential students, and so she manages that caseload and has monthly conferences for each student, and then twice a year, actually goes out to the facility to visit the student. Some administrative costs, myself, I supervise the clinical counselors, and so a portion of salaries for those supports are now going to be realigned into this mental health money. And if you want to know the specific breakdown, the very last page actually has where you see WSMH, that would be the percentage of that person's time that's allocated to mental health.
What percentage did that used to be paid out of?
It would have been, some of these were paid in the past out of XPUT, and some of them were paid out of regional services.
And we were never paid out of the mental health money that filtered into filtered into the Western SELPA, correct?
We didn't have mental health money that filtered in. We had free referral mental health money that was allocated directly out to the districts. That was specific.
So why are we using money that's coming in now to pay people's salary when we used to utilize other?
Because this money is, we're trying to align what people do, their jobs, with the service. So like we have some people that are paid partly out of the XPOT because their main job would be to chair IEPs for our non-public school staff, or they do the budgeting and invoicing and payments for our non-public schools, non-public agencies. That is a function of the XPOT. So part of their salary is paid out of the XPOT, part of their salary would be paid out of regional services. Now we have a whole nother area, some of which we've been doing and some of which we haven't. And so we're trying to take the people and realign it. Also, the benefit of doing it that way is this money can only be used for mental health services. It's restricted money. By moving them out of the XPOT, then the XPOT money is all money each district pays in. So then the district has less cost.
Okay, and last year and part of the year before that, the AB 2726 funding, Western SELPA did not see the kids. They were not referred to Western SELPA. The school districts had to handle those children, correct?
No.
The counseling.
Prior to this, Department of Behavioral Health provided the
Right,
AB
and then
26, not the school district.
Right, the year gap when there was no funding or no nothing, then it was the school district's responsibility if a child needed anything under AB 2726, correct?
No, this mandate went in effect July 1st, 2011. Now,
Right.
our particular Department of Behavioral Health, because of all of the lawsuits regarding Governor Schwarzenegger's action and not funding the mandate,
Right.
they stopped services in January.
Okay.
The SELPA took on those services,
The SELPA saw all those kids.
or we contracted
How
out with
many
people.
kids did you actually see that the Department of Mental Health was actually seeing?
We had 78 students who were receiving AB services, and we had 18 referrals that hadn't been assessed.
Okay. And the school
I think that's
districts
an
have a
approximate
lot
number,
of kids. And they still do have a lot of kids that they seek counseling. So I'm kind of confused why this money would not be filtered into the school districts that took on the responsibility when there was a loophole in the law and a loophole in the budget, and they had to actually get counseling for these kids. Why this money isn't being funneled into the school districts that are already doing the counseling and getting the treatment for the kids.
Last year, the governor made available funding to the schools at the last minute, it was about May. We got funding, and we used that to pay for the counseling services that were provided.
So I'm just kind of
Yeah.
confused why this money isn't being filtered into the school district that already had to figure out how to provide services, like OMSD, and I believe it's Chino that's also gonna do it, and Upland already started, where they have clinical counseling now. They actually opened up clinical counseling where, you know, they can get reimbursed by Medi-Cal and all that, because they had to figure out how to meet the needs of these kids. So I'm wondering how
These particular students, as far as I know, when we met with the districts, we asked because it is Chino and Ontario Montclair have started their own Medi-Cal clinic. It is not specific to special education. They have to accept any Medi-Cal eligible student. Okay? And that funding's separate. And when we asked if they would be, seeing these students, that if we wanted to send those referrals over because we were trying to, get services. I had 78 kids I needed to get services for. And we asked them, the districts told us that at that point, clinics were new, that they were not going to, they wanted us to continue and see those. Yeah.
And this year, because ours has been open, I think they can see 100 kids now. And then next year can be, I think, like 100.
Right, they're just building up. And if you see what, if you kind of look through this, the districts have the option of referring to West End SELPA for these services. Because there's still a fee for service, it's just coming out of the mental health money. If they don't refer to, then that money goes to the district, and the district can provide the
That's what I'm
service.
getting, how can it go to the district if all of a sudden you're taking some of this money to pay salaries? Then it can't be. That's what I'm getting to. That means our school districts are getting less money. When there is leftover money, they're gonna get less money now because we're gonna be paying salaries out of this money now instead of it coming out of the X pot.
It's still the district's money, whether it's the X pot or, the X pot is the district's money.
It's all district's money. And as I remember, the superintendents have tabled that agenda item twice already.
Then, it does mention that we're currently working with Department of Behavioral Health so that we can develop an MOU. Our agreement for the MOU, they will only use that money to pay for vendored services for people who are vendored with Department of Behavioral Health. Then, secondly, because this is an expansion of what we've been doing, we are requesting that we hire an office specialist. She would work 75% in mental health funding and 25% from the X-Pot, because she would also support our school psychologist who chairs the non-public school, non-public agency IEP, so it's not all just mental health.
Will this change the fee that we have for the clinical parent training? The fee that's studied at lower generation?
Right, the clinical parent training does not pay for itself.
Right.
We kind of charge a token fee, just,
To support the paperwork.
yeah, it's more to support your commitment to the program, and people find that if people have to at least pay some fee, that they're more committed
To come, yeah.
to come.
It's just such
People
a good
can't afford the fee, it's voluntary,
So,
so.
no, we said 75% of the time that office specialist is gonna be in mental health, 25% of where that office specialist is gonna be at.
They would be scheduling IEPs for non-public schools and non-public agencies and following up with all of the paperwork related to that.
Okay, but what about a school district that does that already?
That's their choice.